C, also known as ascorbic acid, is one of the most well-known and widely used vitamins in the world, and for good reason. It plays a vital role in maintaining overall health and well-being, affecting everything from immune function and skin health to tissue repair and antioxidant protection. As a water-soluble vitamin, it is not stored in the body, which means we need to consume it regularly through diet or supplements. Though often associated with fighting off the common cold, the benefits of vitamin C go far beyond immune support. One of the most critical functions of vitamin C is its role in collagen synthesis. Collagen is a structural protein found in skin, bones, muscles, tendons, and blood vessels. Without adequate vitamin C, the body cannot properly produce collagen, which can lead to weakened connective tissues, slower wound healing, and skin that loses its elasticity. By supporting collagen production, vitamin C helps keep the skin firm, youthful, and resilient. It also promotes faster recovery from injuries, surgery, or muscle strain, making it essential for active individuals and athletes alike. Vitamin C's antioxidant properties are another key reason for its importance in human health. As an antioxidant, vitamin C neutralizes free radicals, unstable molecules that can cause oxidative stress and damage cells. Over time, oxidative stress contributes to aging and the development of chronic diseases, including heart disease, cancer, and neurodegenerative disorders. By reducing oxidative damage, vitamin C plays a protective role in cellular health and longevity. It acts as a defense system for every cell in the body, helping to reduce inflammation, slow the aging process, and lower the risk of many chronic illnesses. This antioxidant capacity also helps protect the skin from the damaging effects of ultraviolet (UV) radiation. Though not a replacement for sunscreen, vitamin C can minimize sun damage, reduce pigmentation, and even promote a brighter complexion. It's often included in topical skincare products for its ability to lighten dark spots, smooth fine lines, and improve overall skin tone. In this sense, vitamin C is not just a nutritional supplement but also a beauty enhancer. One of the most popular and widely recognized benefits of vitamin C is its role in immune function. It supports various aspects of the immune response, including the production and function of white blood cells, such as neutrophils, lymphocytes, and phagocytes, which are essential for fighting infections. It also strengthens the skin's barrier function, helping to prevent pathogens from entering the body. Furthermore, vitamin C enhances the activity of antibodies and supports the function of cytokines, chemical messengers that regulate the immune response. People with sufficient levels of vitamin C often experience milder symptoms and faster recovery when dealing with colds, flu, or other infections. While it may not completely prevent illness, consistent intake of vitamin C can reduce the duration and severity of infections and boost overall immune resilience. Additionally, vitamin C helps reduce inflammation associated with illness, aiding in quicker recovery and less discomfort during periods of sickness. Beyond its immune-boosting effects, vitamin C has shown significant benefits in supporting heart health. It helps lower blood pressure in both healthy individuals and those with high blood pressure. Vitamin C improves the dilation of blood vessels, which allows blood to flow more easily and reduces strain on the heart. It also helps reduce levels of LDL cholesterol and triglycerides while increasing HDL, good cholesterol, contributing to a healthier cardiovascular profile. Moreover, by reducing oxidative stress and inflammation in the blood vessels, vitamin C helps prevent the development of atherosclerosis, a condition in which plaque builds up in the arteries, increasing the risk of heart attack or stroke. These cardiovascular benefits make vitamin C a simple yet powerful ally in maintaining a healthy heart, especially when paired with a balanced diet and regular physical activity. In addition to protecting the heart, vitamin C supports brain health and cognitive function. It is involved in the synthesis of neurotransmitters such as dopamine, norepinephrine, and serotonin, which are critical for mood regulation and mental clarity. Vitamin C also helps protect the brain from oxidative stress, which is believed to play a role in the development of conditions like Alzheimer's disease and dementia. In fact, the brain maintains some of the highest concentrations of vitamin C in the body, emphasizing its importance in neurological health. Individuals with higher intakes of vitamin C often report better memory, focus, and emotional stability. Furthermore, vitamin C may help reduce symptoms of anxiety and depression by regulating neurotransmitter levels and decreasing brain inflammation. This dual impact on both mental performance and emotional health highlights the comprehensive power of vitamin C. Another major benefit of vitamin C is its ability to enhance the absorption of iron from plant-based sources. Iron is a vital mineral involved in transporting oxygen throughout the body and supporting energy production. However, the non-heme iron found in plant foods like spinach, lentils, and beans is less easily absorbed by the body compared to the heme iron found in meat. Vitamin C converts non-heme iron into a more absorbable form, significantly improving iron uptake and helping to prevent iron deficiency anemia. This is particularly important for vegetarians, vegans, and individuals with limited meat consumption. Including a source of vitamin C with iron-rich meals, such as squeezing lemon over cooked spinach or drinking orange juice with a lentil dish, can dramatically enhance nutrient absorption and support sustained energy levels. Vitamin C also plays a role in detoxification and liver function. It supports the activity of enzymes involved in detoxifying harmful substances in the liver and helps regenerate other antioxidants, such as vitamin E and glutathione. This synergistic relationship enhances the body's ability to eliminate toxins and maintain a healthy internal environment. Moreover, vitamin C has been shown to support kidney health by helping prevent the formation of certain types of kidney stones, particularly when taken in proper, balanced amounts. It may also provide relief for people with gout by lowering uric acid levels in the blood, reducing the risk of painful flare-ups. These additional benefits make vitamin C a multifunctional vitamin with widespread effects on various organ systems. Pregnant women also benefit greatly from sufficient vitamin C intake. It supports the development of the baby's bones, skin, and blood vessels and helps the mother absorb more iron, which is essential during pregnancy. Moreover, adequate vitamin C contributes to the strength of the amniotic sac, reducing the risk of premature rupture or other complications. Since pregnancy increases nutritional demands, ensuring enough vitamin C intake is essential for both mother and baby. Breastfeeding mothers also require adequate levels of vitamin C to support the health of their infants, as the vitamin is passed through breast milk and aids in the newborn's immune development and growth. Even in the context of cancer prevention and treatment, vitamin C has received increasing attention. Its antioxidant effects help protect DNA from mutations and cellular damage that may lead to cancer development. Vitamin D, often referred to as the sunshine vitamin, is one of the most vital and multifunctional nutrients required by the human body. It plays a fundamental role in maintaining overall health, and its significance extends far beyond what most people realize. While it is well known for promoting strong bones and preventing conditions like rickets and osteoporosis, its functions are much broader, influencing everything from muscle strength and immune function to mood stability and chronic disease prevention. Unlike most vitamins, vitamin D functions more like a hormone, and every single cell in your body has a receptor for it. This makes it a major player in regulating processes throughout your system. The body can produce vitamin D naturally when your skin is exposed to sunlight, particularly ultraviolet B, UVB, rays. This is why it's commonly called the sunshine vitamin. Just 15 to 30 minutes of midday sun exposure on the face, arms, and legs several times a week is often enough for many people to maintain healthy levels, though factors like skin tone, age, geographic location, season, clothing, and sunscreen use can greatly affect synthesis. For example, individuals with darker skin require more sun exposure to produce the same amount of vitamin D as those with lighter skin. Additionally, older adults and people living in northern climates often struggle to get sufficient sunlight year-round, putting them at greater risk of deficiency. Once produced in the skin or consumed through food or supplements, vitamin D undergoes two transformations in the body to become active. First, it's converted in the liver to a compound called calcidiol, and then in the kidneys to calcitriol, the biologically active form of vitamin D. This active form plays a central role in regulating calcium and phosphorus absorption in the intestines, which are critical for maintaining healthy bones and teeth. Without enough vitamin D, the body cannot properly absorb calcium, leading to soft, brittle bones and an increased risk of fractures. In children, this deficiency manifests as rickets, a condition that causes bone deformities and delayed growth. In adults, it contributes to osteomalacia and osteoporosis, conditions characterized by bone pain, muscle weakness, and a high risk of breaks and sprains. For these reasons alone, vitamin D is essential, especially for aging populations who are already susceptible to bone thinning and loss of muscle mass. But the impact of vitamin D goes even further than skeletal health. Studies have shown that it plays a crucial role in supporting the immune system. It enhances the function of immune cells, including T cells and macrophages, which defend your body against pathogens. This means adequate vitamin D levels may help reduce your risk of infections, including colds, flu, and even certain respiratory illnesses. During the COVID-19 pandemic, there was a surge in interest around vitamin D due to its potential role in reducing the severity of respiratory infections. While research is still ongoing, observational studies suggested that individuals with low vitamin D levels were more likely to experience severe outcomes. This further highlights how this vitamin contributes to a well-functioning immune response. Beyond immunity and bone health, vitamin D is also linked to muscle function. Deficiency in vitamin D can lead to muscle weakness, particularly in the legs and lower body, which in turn increases the risk of falls in older adults. Several studies have found that people who supplement with vitamin D have better muscle strength and coordination, particularly in populations over 60. This makes vitamin D especially valuable for mobility, balance, and overall physical independence as we age. Another fascinating aspect of vitamin D is its connection with mood and mental health. Receptors for vitamin D are found in many parts of the brain, including those involved in regulating mood and behavior. Low levels of vitamin D have been associated with an increased risk of depression, seasonal affective disorder, SAD, and even cognitive decline. This is especially notable in the winter months when sunlight exposure is limited, and many people experience a dip in mood. While vitamin D is not a cure-all for depression, maintaining adequate levels may play a supportive role in emotional stability and mental clarity. Moreover, vitamin D has been implicated in the regulation of inflammation and the prevention of chronic diseases. Inflammatory conditions such as rheumatoid arthritis, multiple sclerosis, type 1 diabetes, and even certain cancers have been linked with low vitamin D status. Though more clinical research is needed to establish causation, there is enough evidence to suggest that maintaining optimal vitamin D levels may contribute to reducing inflammation and supporting long-term health. Vitamin D also helps maintain heart health by supporting proper blood pressure regulation and reducing the risk of cardiovascular disease. Some studies indicate that people with higher levels of vitamin D have a lower risk of heart attacks, stroke, and other cardiovascular events, although the mechanisms are still being studied. The widespread deficiency of vitamin D worldwide makes this nutrient a public health concern. It's estimated that over 1 billion people globally have insufficient or deficient levels of vitamin D. This is especially prevalent in regions with limited sunlight, among people who spend most of their time indoors, and in communities with dietary restrictions or limited access to vitamin D-rich foods. Fatty fish such as salmon, mackerel, and sardines are excellent sources, as are egg yolks, beef liver, and fortified foods like milk, cereals, and orange juice. However, most people find it difficult to meet their daily needs through food alone, making supplementation a practical and often necessary solution. The recommended daily intake of vitamin D varies depending on age, health status, and exposure to sunlight. For most adults, the general guideline ranges from 600 to 800 IU, international units, per day. However, some experts suggest that higher doses, up to 2000 IU daily, may be more effective in maintaining optimal blood levels, especially for individuals at risk of deficiency. It is always best to consult with a healthcare professional and, ideally, get a blood test to determine your vitamin D status before starting any high-dose supplement regimen. Vitamin D supplements come in two main forms, D2, ergocalciferol, and D3, cholecalciferol. While both can raise blood levels, D3 is generally considered more effective and longer-lasting in the body. For people with absorption issues or specific health concerns, there are even liquid and prescription-strength versions available. One should also remember that while vitamin D is crucial, more is not always better. Excessive vitamin D intake, especially from supplements, can lead to toxicity, a rare but serious condition that causes calcium buildup in the blood, leading to nausea, vomiting, weakness, kidney damage, and other complications. This condition, known as hypervitaminosis D, usually occurs when people take megadoses over an extended period. Hence, moderation and medical guidance are key. Vitamin E is a powerful, fat-soluble antioxidant that plays a critical role in maintaining human health. It is best known for protecting cells from oxidative stress, supporting skin and eye health, strengthening the immune system, and maintaining overall vitality. As an antioxidant, vitamin E helps neutralize free radicals, unstable molecules that can damage cells, proteins, and DNA, ultimately contributing to aging and chronic diseases. This essential nutrient is not just a supplement for occasional use, it is a vital compound that should be consistently present in your diet to maintain the integrity and proper function of almost every organ system. One of the most significant functions of vitamin E is its ability to guard against oxidative damage to cell membranes. Every cell in the human body is surrounded by a lipid membrane that serves as a barrier, controlling what enters and leaves the cell. Free radicals, which are often generated by pollution, cigarette smoke, ultraviolet light, and normal metabolic processes, can damage these membranes, weakening cells and accelerating aging. Vitamin E, by residing within these lipid-rich membranes, acts as a bodyguard, stabilizing and protecting them from being attacked by oxidative agents. This preservation of cellular health contributes to slower aging, healthier skin, and reduced risk of chronic conditions such as cardiovascular disease and cancer. The immune system also benefits greatly from adequate vitamin E intake. It enhances the function of white blood cells, especially T cells, which are crucial for identifying and eliminating viruses, bacteria, and other pathogens. In older adults, whose immune systems may naturally weaken with age, vitamin E can help improve immune responsiveness, increase resistance to infections, and accelerate recovery times. Moreover, it has been observed to enhance the production of natural killer cells and boost the activity of antibodies, making the body more resilient against common illnesses like the flu or colds and reducing the frequency and severity of infections. This makes vitamin E especially vital for the elderly, people with weakened immunity, and those exposed to high levels of environmental stressors. Furthermore, vitamin E supports anti-inflammatory processes by modulating cytokine production and inhibiting enzymes responsible for inflammation. Chronic inflammation is at the root of many modern diseases, including diabetes, arthritis, Alzheimer's, and cardiovascular disease, and vitamin E's ability to keep inflammation in check makes it a powerful preventive nutrient. In terms of cardiovascular health, vitamin E has shown promising protective benefits. It helps prevent the oxidation of low-density lipoprotein, LDL, cholesterol, the so-called bad cholesterol. When LDL becomes oxidized, it becomes more likely to stick to artery walls, leading to the buildup of plaque and atherosclerosis, a condition that narrows and hardens arteries and increases the risk of heart attack and stroke. By preventing LDL oxidation, vitamin E helps maintain cleaner, more flexible arteries and better circulation. In addition, vitamin E's anticoagulant properties can help prevent blood clots from forming within arteries, reducing the risk of life-threatening events like pulmonary embolism or deep vein thrombosis. While vitamin E is not a cure-all for heart disease, its role in maintaining vascular integrity, improving endothelial function, and reducing systemic oxidative stress makes it an essential component of a heart-healthy lifestyle. Vitamin E is also well known for its cosmetic and dermatological benefits. It has been a staple in skincare products for decades, thanks to its ability to deeply moisturize the skin, heal scars, and improve skin texture and tone. Applied topically or consumed through diet, vitamin E promotes healthy skin by enhancing collagen production, accelerating wound healing, and soothing inflammation caused by conditions such as eczema and psoriasis. It can help reduce hyperpigmentation, protect against UV-induced damage, and slow the appearance of fine lines and wrinkles. Its antioxidant properties enable it to fight off environmental stressors like pollution and smoke that damage the skin barrier. Moreover, vitamin E improves blood flow to the skin, giving it a healthier, more radiant appearance. These benefits are particularly important for people living in urban environments or harsh climates where exposure to harmful elements is unavoidable. In conjunction with other vitamins like vitamin C, vitamin E enhances skin rejuvenation, making it a valuable ally in both anti-aging regimens and therapeutic treatments for skin disorders. Eye health is another area where vitamin E plays a pivotal role. The retina is rich in polyunsaturated fats and highly vulnerable to oxidative damage, which can lead to vision problems and diseases such as age-related macular degeneration, AMD, and cataracts. Vitamin E helps protect eye cells by neutralizing oxidative damage and maintaining the clarity of the lens. People with sufficient levels of vitamin E are less likely to develop these degenerative eye conditions, and supplementation may slow their progression in some cases. Combined with other nutrients like zinc, vitamin C, and beta-carotene, vitamin E forms a potent defense against vision loss and supports overall eye function, especially in aging populations. In terms of reproductive health, vitamin E is essential for both men and women. For men, it supports the integrity of sperm membranes, improving sperm motility and protecting sperm cells from oxidative stress, which can lead to infertility. For women, vitamin E plays a role in regulating hormone balance, reducing symptoms of premenstrual syndrome, PMS, and supporting the health of the uterus. During pregnancy, adequate levels of vitamin E are critical for fetal development, particularly in the brain and nervous system. It also helps prevent complications such as preeclampsia and promotes healthy tissue growth in the developing baby. Its role in reducing oxidative stress makes it especially important during the rapid cell division and growth that occurs in pregnancy. In neurological health, vitamin E helps protect neurons from oxidative damage. The brain, being one of the most metabolically active organs in the body, generates large amounts of free radicals during normal functioning. Without sufficient antioxidant protection, these radicals can contribute to the degeneration of nerve cells, resulting in cognitive decline and neurological diseases like Alzheimer's and Parkinson's. Several studies have shown that vitamin E supplementation can help slow the progression of mild cognitive impairment and may improve memory and cognitive performance in older adults. It also supports myelin sheath integrity, which is critical for proper nerve transmission. As such, vitamin E is a valuable nutrient in maintaining mental sharpness, preventing age-related brain disorders, and supporting mood regulation. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays an incredibly important role in numerous functions throughout the human body. Despite being needed in small amounts, its impact is profound and far-reaching. This essential nutrient contributes to the production of red blood cells, supports proper nerve function, aids in DNA synthesis, and plays a central role in maintaining healthy brain activity. A deficiency in vitamin B12 can lead to a wide array of health issues, from fatigue and memory loss to severe neurological damage and anemia. One of the most well-known and immediate benefits of vitamin B12 is its role in preventing and treating megaloblastic anemia, a condition in which the body produces abnormally large red blood cells that are inefficient at carrying oxygen. This type of anemia leads to symptoms such as tiredness, weakness, lightheadedness, and shortness of breath. When vitamin B12 levels are sufficient, red blood cells form properly and function optimally, helping to transport oxygen efficiently throughout the body and keeping your energy levels high. This is why people who are deficient in B12 often complain of feeling chronically fatigued or mentally foggy. Another critical benefit of vitamin B12 is its support of the nervous system. It contributes to the production and maintenance of the myelin sheath, a protective covering that surrounds and insulates nerves. When this sheath is damaged or begins to deteriorate due to a lack of B12, nerve signals can become disrupted, leading to symptoms like numbness, tingling in the hands and feet, poor coordination, and even irreversible nerve damage if left untreated. This is especially important for older adults, who are at higher risk of B12 deficiency due to decreased absorption and are more likely to experience balance problems or mobility issues. Ensuring an adequate intake of B12 helps support proper nerve signaling and can reduce the risk of age-related neurological degeneration, including conditions such as peripheral neuropathy. Beyond physical health, vitamin B12 also has a deep influence on cognitive function and mental clarity. It helps in the synthesis of neurotransmitters, the chemicals responsible for mood regulation and communication between brain cells. Low levels of B12 have been associated with cognitive decline, poor concentration, memory loss, and in more severe cases, dementia and Alzheimer's disease. Supplementing with vitamin B12, especially in older populations or those with known deficiencies, has been shown to improve memory, sharpen focus, and even elevate mood. In some cases, correcting a B12 deficiency has led to dramatic improvements in mental performance and emotional well-being. Furthermore, vitamin B12 plays a vital role in the production of DNA, the genetic material found in all cells. This makes it particularly important during periods of rapid growth and development, such as pregnancy, infancy, and adolescence. Expecting mothers require adequate levels of B12 to support the healthy formation of the baby's nervous system and to help prevent birth defects like neural tube abnormalities. When combined with folate, vitamin B9, B12 ensures that cells divide and replicate properly, supporting overall growth and vitality. In addition to its role in DNA synthesis and red blood cell production, vitamin B12 also contributes to a healthy metabolism. It is involved in converting the food we eat, particularly fats and proteins, into usable energy. People with low B12 levels often report sluggishness, weakness, or a general lack of vitality, not because they aren't eating enough but because their body is struggling to turn nutrients into fuel. By maintaining optimal B12 levels, your body can metabolize nutrients more efficiently, keeping energy levels balanced and reducing the likelihood of metabolic imbalances. A less commonly discussed but equally significant benefit of vitamin B12 is its ability to support cardiovascular health. It works alongside vitamins B6 and folate to reduce levels of homocysteine, an amino acid that, when elevated, has been linked to an increased risk of heart disease, stroke, and blood clot formation. High homocysteine levels can damage arteries and contribute to plaque buildup in blood vessels, potentially leading to serious cardiovascular events. By regulating homocysteine through proper B12 intake, you may lower your risk of heart-related issues, making B12 a small but powerful ally in heart health. Additionally, vitamin B12 supports the health of hair, skin, and nails by playing a role in cell reproduction and the constant renewal of tissues. A deficiency in this vitamin can lead to various dermatological symptoms such as hyperpigmentation, nail discoloration, hair thinning, dry or cracked skin, and even mouth sores. When B12 levels are optimized, many people notice improvements in the appearance and strength of their hair and nails, as well as clearer and more radiant skin. In this way, B12 acts as a beauty-supporting nutrient in addition to its internal physiological benefits. For people following a vegan or vegetarian diet, vitamin B12 supplementation is especially important because natural food sources of this vitamin are almost exclusively animal-based. Foods rich in B12 include meat, eggs, dairy products, poultry, and fish such as salmon, tuna, and sardines. While some fortified plant-based products like nutritional yeast, plant milks, and breakfast cereals contain added B12, they may not always provide sufficient amounts, particularly if consumed irregularly. Therefore, individuals avoiding animal products are strongly advised to take a reliable B12 supplement to avoid deficiency. In fact, even meat eaters are not entirely exempt from the risk. Absorption of B12 becomes more difficult with age or in people with gastrointestinal conditions such as celiac disease, Crohn's disease, or those who've undergone certain types of gastric surgery. Medications like proton pump inhibitors and metformin can also interfere with B12 absorption, so it's important to regularly check levels, especially if you fall into one of these categories. One of the more subtle but emotionally impactful effects of B12 is its connection with mental health disorders such as depression and anxiety. B12 helps regulate the nervous system, and when levels are low, neurotransmitter activity may become imbalanced. This can result in mood disturbances, increased irritability, and heightened feelings of sadness or anxiety. Some studies have suggested that individuals suffering from depression are more likely to have low B12 levels, and that supplementation, especially when combined with other therapies, may contribute to mood stabilization and emotional balance. In some cases, individuals report a noticeable difference in mood and mental resilience after restoring B12 levels through diet or supplements. While it's not a standalone cure, B12 remains a valuable tool in managing mental well-being. Athletes and active individuals also benefit greatly from sufficient B12 intake, as it supports stamina, oxygen delivery, and muscular endurance. Since it's vital for red blood cell production and energy metabolism, B12 helps improve physical performance and reduces fatigue during prolonged activity. Many athletes and fitness enthusiasts supplement with B12 to maintain peak performance, faster recovery, and enhanced focus during workouts. Vitamin B1, also known as thiamine, is one of the most essential water-soluble B-complex vitamins, responsible for a wide range of vital functions that sustain life and health. Often underestimated in the modern nutritional landscape, thiamine plays a pivotal role in converting the carbohydrates we eat into usable energy, making it indispensable for daily activities and long-term physical and mental vitality. It acts as a coenzyme in the metabolism of glucose, which is the body's primary source of energy, particularly for the brain and nervous system. Without adequate levels of thiamine, cells, especially those in the heart, brain, and muscles, struggle to generate energy, leading to fatigue, weakness, mental fog, and even serious neurological or cardiovascular complications over time. In many ways, thiamine acts as the spark plug of the human body, initiating energy production and keeping the metabolic engine running smoothly. Because it cannot be stored in large quantities in the body and is easily depleted through stress, alcohol, poor diet, or certain medications, a consistent daily intake is essential. Beyond its role in energy production, thiamine is especially critical for proper nerve function. It contributes to the development and maintenance of the myelin sheath, a protective coating around nerves that ensures fast and accurate transmission of electrical signals. Damage to this sheath can result in symptoms such as tingling, numbness, muscle cramps, or loss of coordination, most notably in the arms and legs. In more severe deficiencies, this can progress to conditions such as peripheral neuropathy, where nerve function is seriously impaired. Thiamine also plays a key role in neurotransmitter synthesis, helping produce acetylcholine, a chemical messenger essential for memory, muscle contraction, and learning. As such, adequate thiamine intake supports mental clarity, alertness, and cognitive performance, and is particularly important for people under high mental stress or with demanding lifestyles. In the elderly, thiamine deficiency has been associated with an increased risk of memory loss, confusion, and cognitive decline, making it a nutrient of particular interest in the prevention of age-related brain disorders like Alzheimer's disease and other forms of dementia. Thiamine also supports cardiovascular health by helping the heart muscle produce the energy it needs to contract efficiently. When the body lacks sufficient thiamine, the heart can struggle to pump blood effectively, leading to symptoms such as shortness of breath, fatigue, and swelling in the legs. In severe cases, a condition called beriberi may develop, which can be either wet, affecting the cardiovascular system, or dry, impacting the nervous system. Wet beriberi can result in heart enlargement, rapid heartbeat, and fluid retention, while dry beriberi is more closely associated with nerve dysfunction and muscle wasting. Although rare in industrialized countries, beriberi remains a serious health issue in populations where diets are heavily reliant on polished rice or highly processed foods that lack sufficient thiamine. Modern cases are also seen in individuals with chronic alcoholism, where alcohol impairs the absorption and utilization of thiamine, leading to deficiencies that can have devastating health effects if left untreated. Alcohol-related thiamine deficiency is also closely linked with Wernicke-Korsakoff syndrome, a serious neurological disorder characterized by confusion, memory problems, coordination difficulties, and even hallucinations. In many such cases, thiamine supplementation can reverse symptoms if caught early, highlighting the nutrient's powerful impact on brain and nerve health. Another crucial yet often overlooked role of thiamine is its contribution to digestive health and appetite regulation. Thiamine helps maintain proper muscle tone in the gastrointestinal tract, supporting effective digestion and the movement of food through the system. Deficiency may lead to loss of appetite, constipation, or indigestion. Additionally, it plays a role in the production of hydrochloric acid in the stomach, which is essential for nutrient absorption and the prevention of bacterial overgrowth. Some research even suggests that thiamine may support the body's natural detoxification processes by helping the liver metabolize toxins more effectively. Because thiamine supports the conversion of nutrients into cellular energy, it is also believed to play a role in maintaining a healthy weight and supporting physical endurance. People who are physically active or recovering from illness often require more thiamine to meet their body's increased energy demands. For athletes, thiamine helps optimize endurance, reduce exercise-related fatigue, and accelerate recovery by facilitating efficient carbohydrate metabolism. It's also vital during periods of growth, pregnancy, or intense mental exertion, when energy requirements are naturally higher. Thiamine's importance doesn't stop at individual systems, it also plays a synergistic role with other B vitamins. For instance, it works closely with vitamins B2, riboflavin, and B3, niacin, in the energy metabolism process. It also complements B6, pyridoxine, and B12, cobalamin, in supporting the nervous system and maintaining red blood cell formation. B vitamin deficiencies often occur together, and the lack of one can impair the function of others. Thus, thiamine supplementation is often done as part of a broader B-complex formula to ensure balanced support. Moreover, thiamine helps regulate blood sugar levels by facilitating the proper metabolism of glucose, and may have a protective effect against complications of diabetes, particularly in preventing nerve damage, diabetic neuropathy. Some studies have even shown that high doses of thiamine can help reduce blood sugar levels in people with type 2 diabetes, indicating potential therapeutic benefits beyond basic nutritional support. Thiamine also holds significance in mental health. Its role in neurotransmitter regulation and energy production means it has a direct impact on mood, anxiety, and emotional resilience. People with low thiamine levels are more likely to experience symptoms such as irritability, mood swings, depression, and poor concentration. It is especially important for individuals under chronic stress, as physical and emotional stress can rapidly deplete the body's thiamine reserves. Some research suggests that restoring thiamine levels can lead to noticeable improvements in mental clarity, calmness, and motivation. Given the rising rates of anxiety and burnout in modern society, ensuring adequate thiamine intake could be a simple yet powerful step toward better mental well-being. Dietary sources of thiamine are diverse and widely available in whole foods, particularly in unprocessed plant and animal sources. Whole grains, especially wheat germ, brown rice, oats, and barley, are excellent sources, although processing and refining grains can strip away up to 80% of their thiamine content. Legumes like lentils, black beans, and peas are rich in thiamine, as are seeds and nuts such as sunflower seeds and macadamia nuts. Animal-based sources include lean pork, liver, fish, and eggs. Fortified foods, such as breakfast cereals and enriched flour, also contribute to thiamine intake, particularly in Western diets.